At the outset, I would like to thank Professor Radhika Tandon for involving me in this course. I'll be talking a little bit about post-surgical ocular homeostasis and then how chloroquine helps in these cases. Now, basically, if you do any surgery, whether it's a cataract surgery or a retinal surgery or glaucoma surgery, the basic idea of any surgeon is to attain a good vision, well-centered lens, nice flap, LASIK, and a good bleb after glaucoma surgery. And then when we achieve all these, we are very happy. But many times patients are not happy because now very often we have seen now that the patients have symptoms of discomfort. And symptoms of irritation, redness, foreign body sensation, they can be seen after any cataract surgery or retinal surgery, glaucoma surgery, and that is a major cause of patient dissatisfaction, because these days we have attained the goal of achieving 6/6 vision and N6 vision in most of our cases. And the basic reason for all these is disturbed ocular surface homeostasis, which is because of inadequate ocular surface hydration. So what happens in LASIK? In LASIK, you cut a flap, create a flap, so you cut the nerves. This is the neuronal loop which you cut, and that results in dry eye. Now, this was a survey done after LASIK, which they found out that 21% of dissatisfied patients due to LASIK was because of dry eye, so that's a huge number. Similarly, a cataract patient, because of his age, which is the age wherein MGD is quite high, you can have coexisting glaucoma, and you alter the curvature. Many times you cut the nerves by creating additional procedures like LRI. So all these factors, they result in dry eye and ocular surface disturbance. Same is for glaucoma. We use antimitotic agents. We have a large bleb and causes fast breakup time. And in retinal procedure also, it has been noted that in eyes which have undergone VR surgery with silicone oil injection, they have higher chance of dry eye. And post-operatively, all these patients, they get some drugs, and that causes toxicity. So a lot of studies, a lot of research has been done in this field. There has been many concepts in order to address the problems. And one of the concept is the development of this quotient, that is ocular homeostasis and hydration quotient, wherein you have a certain numerator which is favorable for the ocular surface, and the denominator is one which affects adversely the ocular surface. And the management, I'm not going into details because it has already been discussed. We use the lubricants, carboxymethyl cellulose or hyaluronic acid. And in order to reduce inflammation, Dr. Vanati was presenting about cyclosporin, topical steroid, omega-3 fatty acids. So all these things have come up. Now, there has been an issue because people still feel, in spite of all these medications, there is something which is missing. And then what actually happened, that patients who are using chloroquine, systemic chloroquine, which is a well-known anti-malarial drug, they got some benefit in dry eye. In Sjogren's syndrome, systemic hydroxychloroquine was being used, and they found out that there is some benefit in terms of symptoms, in terms of the signs of dry eye. And then from there, people started working, doing research, and they found out that what is the exact mechanism. So what they found out, that normally when there's any inflammation, there are macrophages, neutrophils on the surface, and they liberate metalloproteases, and they cause apoptosis of surface epithelial cells. And chloroquine inhibits the release of metalloprotease, and this perhaps reduces the apoptosis of the ocular surface, and thereby the symptoms related to dry eye. And then a lot of studies were initiated, and initially there was animal study in terms of safety, in terms of efficacy. They found out that chloroquine is effective. Then they did the safety trial on animals, and they found out that it was quite safe. There was no adverse effect. Then they started doing the human trial, and the phase 1 study was done. Although the number was less initially, but they found out that there was definite improvement in symptomatology, and there was no adverse reaction as far as the use of chloroquine is concerned. And they were, in terms of improvement in ocular surface issues, they found out that there was definite improvement in breakup time, And there was improvement in Schirmer's value. There was improvement in the staining that was seen in these ocular surface disorders because of apoptosis, and there was no adverse effect. This was one of the major studies which found out that there was significant improvement in breakup time, Schirmer's test, fluorescein staining, symptoms, and in microscopic examination they found out that the apoptosis was significantly reduced, and the study felt that there was definite beneficial effect of chloroquine. And the chloroquine in this study was used for 3 weeks, and the efficacy was detected after 4 weeks. So the study concluded that there's definite effect of hydroxychloroquine in reduction of apoptosis, in reduction of symptoms, in improvement in signs and breakup time, etc., and staining. And it remains at least till 1 week after the cessation of treatment, after withdrawal of treatment. And there was no adverse event seen in this. So finally, most of the studies that have done, they have concluded that apoptosis is an issue in ocular surface disorder, which can result in all these symptoms, and chloroquine phosphate has been found to be useful in reducing apoptosis in order to reduce symptoms and improve the parameters of ocular surface in dry eye patients. Thank you very much.